Hi everyone, we're about to get started. So for those of you on the phone, please remember to mute your phones so that we don't hear disturbances or noises. So hi everyone, so thanks for joining us in the first seminar of the 2018-2019 series. My name is Tina Chen and I'm a knowledge translation scientist at the National Collaborating Center for Environmental Health. So just a few housekeeping items before we start. For those of you on the phone attending as a group, if you would like to receive sci-fi educational credits, please email me so I can mark you as present. And I will put my email address in the chat box. So during the Q&A period after the presentation, please enter your questions into the chat box and we'll answer your questions accordingly. So today we have the pleasure of having Maria Mukhtar and David Guillette from Peel Region in Ontario to talk about Peel Public Health Healthy Development Mapping and Monitoring Project. Maria is a research and policy analyst at the Region of Peel Public Health on the Built Environment team. Her interests include healthy land use planning and community design. She studied political science and geography at the University of Toronto. David is a GIS specialist at the Region of Peel with 8 years of experience working across various levels of government. He studied at Laurentian and Lakehead with a focus on history, geography, and education prior to earning a postgraduate certificate in GIS. His interests include human geography, demographics, spatial analysis related to sustainable communities, and cartography. Thank you, Maria and David.
Thank you for introducing us, Tina. Can you hear me okay?
Yes, we can. Thank you.
Perfect. Okay, well, I'll just get started then. Welcome, everybody. My name is Maria Mukhtar, as Tina just mentioned, and I'm a research and policy analyst at the Region of Peel in Public Health in the Division of Chronic Disease and Injury Prevention on the Built Environment team. So the Built Environment team includes portfolios in healthy land use, transportation, road safety, affordable housing, and healthy food environments from a public health perspective.
Hi, and I'm David. I'm a GIS and data specialist with the Region of Peel, sitting with the Peel Data Center.
Perfect. So we would like to begin by acknowledging that the land on which we gather and on which the Region of Peel operates is part of the treaty lands and territory of the Mississaugas of the New Credit. Peel Region, the traditional territory of the Anishinaabeg, Huron-Wendat, Haudenosaunee, and home of the Métis, was most recently the territory of the Mississaugas of the New Credit First Nation. On this day, our meeting place is still occupied by many Indigenous peoples from across Turtle Island. We're grateful to have the opportunity to work on this land, and by doing so, we give our respect to its first inhabitants. So again, welcome and thank you for joining us today. We're here to talk about Peel Public Health's Healthy Development Mapping and Monitoring Project. The project builds a series of built environment indicators and maps them out to understand the spatial distribution of neighborhoods that either facilitate or constrain active transportation.
Sorry, Maria. We have a question here in the audience.
Yeah, for your land acknowledgement, when you you're offering a definition of Indigenous, and were the examples of First Nations, Métis, and Inuit? Are there any other examples and the positionality of that? And why I'm asking is because Indigenous is not defined like Aboriginal, which is constitutional, as well as defined in that evil piece of legislation called the Indian Act. So I just want clarity of when you invoke and use the word Indigenous throughout the presentation, what exactly do you mean by Indigenous?
Thank you so much for your question there. I think so. We just use this as something that our regional council also uses as well. I'd be happy to answer that question offline, as that's something that we've started to put in at the Region of Peel as a land acknowledgement at the front of our presentations. But I'd be happy to take this offline further after the presentation if you'd like. Okay, so sorry, Tina, I'm not sure. Should I could just continue the presentation then?
Yes, you should continue.
Okay, so we're here to talk about Peel Public Health's Healthy Development Mapping and Monitoring Project. So the project, like I said, builds a series of built environment indicators and maps them out to understand the spatial distribution of neighborhoods that either constrain or facilitate active transportation opportunities. So in this webinar, we're going to be providing an overview of the methodology and collaborative decision-making process required to create built environment indicators, a description of the indicators themselves, and their role in measuring the health-promoting potential of neighborhoods in Peel. We will also be presenting a demonstration of the Healthy Development Monitoring Map, which is an online interactive story map displaying these built environment indicators, and our Peel Walkability Composite Index. So before we go further into what this project is about, I first wanted to touch on how and why we decided to create this project. So the context for this project is the region of Peel, which is an upper-tier municipality located to the west of the city of Toronto. Peel is made up of 3 lower-tier or local municipalities, the city of Mississauga in the south, the city of Brampton in the middle, and the town of Caledon in the north. The population of Peel is growing rapidly and is anticipated to grow from 1.38 million to 1.64 million by 2031. In terms of land use and housing type, Peel, like many suburban areas in Ontario, and I imagine in other provinces and jurisdictions, is dominated by low-density development, such as a surplus of detached homes with large lot sizes, services that need to be driven to, street patterns that are obstacles to walking, and retail centers with extensive parking lots that cater exclusively to the automobile. So the outcome of this is really a low-density, auto-dependent community which impacts our residents' travel behaviors. So this graphic here demonstrates that many Peel residents drive to work, either as a passenger or a driver of an automobile. So auto-dependency really contributes to low levels of physical activity and decreased use and availability of public transportation. It also leads to an environment with increased rates of chronic health conditions such as obesity and diabetes. As a public health unit, our goal is to get our population engaged in more active modes of transportation, such as walking, cycling, and public transit use throughout their day. So we know that the built environment can either facilitate or constrain active transportation opportunities, and supportive built environments are key to maintaining a healthy lifestyle and promoting utilitarian walking. So with that in mind, Peel Public Health recognized that influencing the built environment through public policy would be a necessary component for population-level prevention of diabetes and other chronic diseases. As a health unit, we realized that we needed to partner with planning departments to develop rules and tools to better define healthy development standards and encourage better integrated land use and transportation planning decisions within our jurisdiction. So Peel Public Health worked with municipal and regional planning departments to develop processes and policies that facilitate the application of healthy development standards and create healthy, complete communities. A complete community provides residents with opportunities to interact, learn, work, play, and live throughout a lifetime, as well as options for housing, employment, services, and recreation, and convenient access to public transportation and options for safe, non-motorized travel. But we also had to ask ourselves and answer the question of what are those design elements of the built environment that facilitate active transportation opportunities and that help build complete communities. So in 2009, Peel Public Health partnered with McMaster University and St. Michael Hospital Center for Research on Inner-City Health and conducted a research review to establish an evidence base for creating healthy built environments in Peel. This was called the Healthy Development Index, or HDI. It identifies 6 core interconnected elements of the built environment that promote active transportation and the creation of healthy, complete communities. So these 6 core elements were density, service proximity, land use mix, street connectivity, streetscape characteristics, and efficient parking. So Peel Public Health used these 6 core interconnected elements to create a health assessment tool called the Healthy Development Assessment, or HDA, that developers can use to assess the health-promoting potential of their proposed development applications. The HDA breaks these 6 core elements down into quantifiable measures. So the HDA is also a part of the Healthy Development Framework, which is a collection of local, context-specific tools for each local municipality that assesses the health-promoting potential of proposed new developments. So all the tools that make up the HDF contain quantifiable standards based on the same evidence base as our Healthy Development Assessment tool to inform planning decisions throughout the region of Peel. So our next step was then to ensure that these tools from the Healthy Development Framework became a consistent and sustainable part of the development application review process. To do this, Peel Public Health partnered with the Regional Integrated Planning Department to introduce supportive policies through the PL 2041 Official Plan Review process. The supportive policy was called the Regional Official Plan Amendment 27, or ROPA 27 as we call it here. It was endorsed by our Regional Council on February 27th of 2017 and approved by the province on September 1st of 2017. So the purpose of ROPA 27 was to implement the Healthy Development Framework and those quantifiable standards to achieve healthier communities and increase physical activity through walking and cycling as forms of active transportation. These new policies are intended to integrate elements of the HDF in local municipal policies, plans, and standards, and it requires health assessments on all applicable development applications, as well as requiring health assessments on all regional or municipal-owned and operated public buildings. And it ensures that the results of these health assessments are reported back to our local council. So in a nutshell, through ROPA 27, there's now a formalized mechanism by which we can influence the development of healthier, complete communities that include those 6 core elements of healthy built environments. So you're probably wondering right now, we're talking a lot about health assessments and supportive policies, but the presentation is supposed to be really on a mapping and monitoring project. Well, the link is that in order for us to evaluate the implementation of ROPA 27 and monitor how the built environment may change by using these health assessment tools, we need to create baseline measures of the health supportive built form elements that currently exist in Peel. This will help us monitor for increases in these built environment elements over time. So that's how the Healthy Development Mapping and Monitoring Project was born. What it does is that it defines and creates quantitative measures of the health supportive built environment infrastructure that currently exists throughout Peel's neighborhood. The objective of the project was to leverage GIS technology to produce a map that establishes a point-in-time assessment or snapshot of what currently exists in Peel's built form. This provides a foundation for us to monitor for changes to the built form and its health-promoting potential over time. So in order to accomplish this, the Healthy Development Monitoring Project had 2 overall objectives. The first one was to develop a set of feasible, valid, and reliable indicators or measures for each of those 6 core elements from our municipal health assessment tools. So those elements of the HDA that I introduced on our previous slide, such as density, service proximity, etc., are the ones that our indicators are actually based off of. The second objective was to visually depict these indicators in an online mapping tool, which will provide us with a picture of the distribution of these 6 core elements and what they look like across Peel's communities. The map itself is titled the Healthy Development Monitoring Map, as the indicators that are being used to generate the data in the map will be rerun every 5 years to monitor for changes in the built environment. So monitoring for these changes in our built environment appeal will help us understand if we are making demonstrable progress through the implementation of our health assessment tools as well as our ROPA 27 policy. So the primary audience for this tool is really our regional council, who acts as our Board of Health, who can use this interactive mapping tool to get a picture of the existing built environment and understand changes over time. This tool is also a valuable resource to our regional and municipal partners in planning, as it's an additional measure to understand the impact of new development and to report on existing community measures. So the project kicked off in January of 2017, and the most intensive aspect of the project has been identifying which indicators will make it into the project and how we'll actually be creating them. This process has taken us a little over a year, which we found out is pretty typical for a project that builds a series of novel indicators from various data sets that need to be linked together. Before I go further into the methods that we used to pick our indicators, I wanted to briefly touch upon the project team structure, which we believe really played a key role in the success of this project. The project built upon interdepartmental links between public health and the Peel Data Center, or PDC as we call it here, who supports data and analytics across our regional planning department. So planning is not typically in public health purview, and although we have access to census data, we needed to partner with the right stakeholders to obtain transportation, urban design, and land use planning data. This partnership with PDC strengthens the level of decision-making in this project and has provided us with more accurate and reliable indicators. Our project team meetings occurred every 2 weeks to ensure that we could bring back decisions to our larger group and keep all team members in the loop about any decisions that we had made about the indicators in the interim. So these update meetings were really key for us as they helped us move forward and gave us a dedicated platform to really make decisions to help move this project along. The project also included a collaboration and feedback through a formal technical advisory committee, or TAC, that consisted of regional policy and development services planners, public health professionals, policy and development services planners from our cities and town, and a professor of GIS from McMaster University. The role of the Technical Advisory Committee was to provide guidance and feedback based on their knowledge of local planning policies and practices or their technical expertise in building and presenting indicators to measure the built environment. So our TAC also provided insight into the applicability of each indicator in their local municipal context, approaches to strengthening the measurement of each individual indicator. So, for example, if there was additional data sets available to us that we didn't know about, they were able to provide that information to us. And also the validation of the results of each indicator. So is the spatial distribution of the indicator aligned with the local planning context and the perception of the built environment infrastructure available in their local municipal communities? So input was received from our TAC members throughout the indicator creation process, as well as the development of our online tool. So I'm just briefly going to go over a high-level process that we undertook to develop our list of potential indicators. We first decided at what level of geography we'd be identifying these indicators, and we decided upon the census dissemination area level, or DA level, as DAs are relatively stable units of geography that capture around 400 to 700 people. This level of geography is also smaller than a census tract, so it allows for a more precise measurement of these indicators. There are approximately 1,650 DAs in Peel. Other than geography, we had additional parameters that we had established that were important to our indicators. So these included measurability, was the concept of the HDA measurable with good quality data that was easily available to us. Could the indicator be easily interpreted? So our information that we captured had to be presented in a way that was easily interpreted by individuals in the field of public health, planning, as well as by our decision makers, so by our counselors. And then was it scoped to include infrastructure and proximity data only? So our project only included built environment infrastructure, and it didn't include the perception of the built environment or level of services in any of our indicator creation. We also had to be mindful of data reliability, repeatability, and reproducibility. So our indicators were used using data sets that had consistently planned updates only. However, that's not to say that all of our data sets have the same quality, as I think David will touch upon in a little bit. Most of our data sets have come from our local municipalities and are administrative in nature, and we needed to vet the quality of these data sets before we could get started. So the process to identify which indicators would make it into the project itself required extensive collaboration with subject matter experts and stakeholders. First, a public health analyst and our data and GIS specialists identified a long list of potential indicators that came from a review of the Healthy Development Index. So that would be our evidence base that outlines the design elements of the built environment that facilitate active transportation opportunities. And it also came from the metrics that were outlined in the Healthy Development Framework, or HDF. So on the slide, we have the HDF metrics highlighted, as the primary purpose of the project is really to monitor for changes in land use planning to evaluate the implementation of our ROPA 27 policy. So because ROPA 27 uses the HDF, it's essential that we focus our indicators and that they're based on the metrics that are provided in the HDF to see if there's measurable changes in our built environment going forward and monitoring over time. We also focused our search on other literature, policy documents, and projects that have been successful in outlining built environment indicators. So just some examples are the province's growth plan performance indicators, the Association of Epidemiologists of Ontario's core built environment indicator data set, and projects such as PHO's environmental scan of built environment indicator data, as well as UBC Design Center for Sustainability indicators as well. So our list of indicators is embedded and validated through our Technical Advisory Committee, as well as our academic expert in built environment indicators from McMaster University. Many of our indicators are typical of what you would find in the literature to measure health-supported built environment elements, such as residential density, diversity of land uses, and housing mix, while others are more unique based on primarily the data that we had available to us. So that would be something like the percentage of sidewalk that's covered by street tree canopy. So creating our indicators can be completed without the use of appropriate data sources. We used 21 total data sets from 14 different data providers to create our indicators. The framework for assessing new data sources, which is an internal document to Peel Public Health, was also used to guide and assess the data sources that we gathered from Peel Data Center. The filters that we used to assess our data was the relevance and the accuracy of the data sets that were given to us, the completeness of the data set, the timeliness, so the delay between when the information was actually collected and when we could actually use it, the accessibility of the data set. So if municipalities didn't want to share the data or we didn't have access to the data, we just decided not to drop that indicator. And then interpretability of the data sets and comparability across our data sets as well as others that we would receive from like the province, for example. So the following here on the slide is an illustration of how we use transportation, urban design, land use planning, and structural elements of the built environment to link our data sets to create our indicators. So on the left-hand side were the data sets that we use to create our built environment indicators, and at the top are the 6 core elements our indicators are based off of. So after identifying the long list of indicators and vetting our data sources, we needed input from our TAC members to help guide us on which indicators were the most feasible, valid, and reliable and relevant in measuring the urban form in their local municipalities, as well as feedback on how to measure these built environment elements. We then set out to actually build the indicators themselves, and within that process, we had to be mindful of data repeatability, as all of our indicators would be rerun every 5 years. This part of the process took considerable time as each data set required unique decisions that needed to be made, and the decisions were only uncovered to us as we actually started to create the indicators themselves. So on the slide here is a list of the 21 indicators that we decided to move forward with on this project. And I'm going to hand it over to David now, who's going to go further into detail about how we created some of these built environment indicators.
Hi, Maria and David. Could you just speak a little bit closer to the phone, or because you're fading out a little bit in and out.
Here, I'll try picking the phone up and going right to my ear with it. Hopefully that thing makes it work clearly. No problem. So as Maria said, what you'll see in a lot of these programs and projects is a commonality amongst indicators and data sets used. So instead of going into detail on how we create our 21 indicators, I really wanted to spend time talking about the differences between what we found in literature and what had been done by other groups and what we were able to do due to the high level of and quality of data we had at Peel Data Center. So the first thing I want to overview is our parcel-based land use data set. So the parcel-based land use data set is a modified version of the assessed parcel fabric provided by TerraNet and the Municipal Property Assessment Corporation. The Region of Peel first started classifying land use at the parcel level in the late 90s. The data is updated every 2 years or during a census year, so it aligns very well with our project goals on the update. The update is first scripted and then confirmed using ground truth exercises, including ortho imagery or Google Street View. Codes are typically not changed during the process, and in the last update, approximately 2% of the parcels had their code changed during the ground truthing exercise. And as of 2016, the Region of Peel had roughly 314,000 parcels. So during this classification process, what we're able to do is we're actually able to look at a parcel level, the type of land use being used. And why this really differs from some of the other projects that we saw is that we can then attach to each individual parcel based on whether or not it's used for typically employment or residential usage, is the service proximity is attached to each parcel. So instead of kind of using a centroid or a population weighted centroid and using Euclidean distance to assume a service catchment, we were actually able to assign at an individual parcel level what was available once we had kind of gone through this update. So what you're seeing on the screen right now is the parcel-based land use for the Region of Peel in 2016. And what we know from this is that again, as Maria said, a lot of our parcels and residential is dominated by low-density residential. Low-density residential, I think, accounts for roughly, 90% of parcel usage at a parcel number level, whereas agriculture accounts for roughly 40% of total area. So again, doing this on the frequency updates that we're able to do with the Region of Peel through the Peel Data Center really provides us a higher level of insight when we do our service-based analysis. So again, as Maria was mentioning, very much dominated by low density land use, trying to drive more land use towards high and medium density to help kind of align with provincial growth targets. And as we can see from this slide here again, low density residential is the dominant force in the Region of Peel. And this next slide here is going to kind of show how we were able to modify our indicators at a parcel level for determining service catchments. So then we can determine based on a approximation of residential land use, approximately the number of people within a dissemination area that had access to a service. So for all the 314,000 parcels in the region of Peel, we created service catchments for each of the indicators that were service proximity based to determine if they had access to frequent transit, parks, grocery store, schools, a bicycle network, community center, library, pharmacy, place of worship, and so on. Also using the general land use classification, we coded these as their land use type and then as residential or employment. So the goal with this was to eventually be able to also run a lot of our service proximity indicators at an employment level. It's not something we proceeded with in this iteration of the project, but it might be something we look at going forward. So here we have just a snapshot of the one highlighted parcel and all the additional attributes that we tracked in the GIS system for determination of service catchments. So the next thing that I've briefly mentioned already and that really made our project kind of different from what we've seen in the literature and that's been produced is instead of using a single dissemination area centroid or population weighted centroid, which a lot of the projects that we saw had done simply because it's a lot easier to do, and a lot of times the organization running the project might not have access to the same level of data that we did, is that we actually wanted to create service catchments for our service proximities at kind of that parcel based level. So we were able to take our single line street network, which we update for the purpose of mostly emergency management systems. The more updated frequency of update on that data set, the higher level of accuracy we have when responding to emergency calls from our EMS systems. So we took that with a high level of confidence that the data we had here would be useful for generating a similar product for service proximity. So the first thing we really had to decide upon was, is it more applicable to use service-derived polygons or service-derived lines? And support in the literature from an ArcGIS or a GIS standpoint is that you'll see lines tend to produce far more accurate service networks. And this is highlighted in the two slides. So if you see the polygon slide and the two circles, is that part of the section along the road network is actually outside of the area. But the polygons, when they were generated from the service access point, because of the algorithm being run, actually includes those parcels when they're actually well offset from the line network itself. But meanwhile, if you look at the line network below, you can see that areas where the service is not within the catchment area have been excluded. So when we were able to do this for each of our individual, we produced a much more high accurate level of detail when determining our service areas for our service proximities. And another thing that we were able to do due to time and the assistance of some summer students we had working with us is a pretty exhaustive ground truthing exercise. So ground truthing is the process in which data collected at a distance through a sensor is verified on location. This process improves interpretation analysis and is a vital process in supervised classification of multispectral imagery. And due to the large volume of access points that required validation, Google Earth and Street View were utilized to provide a proxy for ground truthing along the pedestrian network for accessibility purposes. So in this example here, we can see our ArcGIS process had actually created a access point, which we were somewhat psyched about, because like you can see there's a fence line along the property border there potentially. So then what we'd have is a student or myself would go through to Google Street View to see if there was actually a pedestrian access point along this location where pedestrians could move to access the service. And as you can see from this case, there's a solid fence, so we would have removed this access point from our methodology before proceeding. So another thing we want to take in consideration while looking at frequent transit was the underneath the track access or over the track access. So using frequent transit, what we relied on was the general transit feed data that we received from the municipalities and Metrolinx for Go Transit. And their access points were simply XY coordinate locations that provided us a snapshot of where the service was actually located, with no consideration for is there other places which the service can be accessed through the pedestrian network. So for each of our GO station locations, we wanted to make sure that we were modeling pedestrian movement as best as we could. So in this example we're looking at here, for the Port Credit GO station, we can see there's actually a tunnel, again, using Google Street View, that allows access to the transit services by moving under the tracks. Now that wouldn't have been captured in the single line street network or pedestrian network, because we have no subterranean networks as of now. So by looking at each of these on an individual basis, we were able to include a much larger residential area within the service. So in total, for all of our service proximities, we looked at roughly 6,000 amenities and services, and that resulted in the creation and validation of 19,000 plus access points, which really, again, provides like a really high level of detail when we're determining our service catchments and delineations. So this is a mapped out example of what I just explained. So you can see originally, had we not included that second access point, we would have missed out on a large area of residential parcels that actually have access to a frequent service transit. So what I'm going to do next is kind of go through a quick example of how, from start to finish, our service proximity indicators would have been created using a real world example that we have here. So what we're looking at here is proximity of residents to food stores, and specifically a No Frills located at 7070 St. Barbara Avenue. So the first thing we obviously did using a data set maintained by the Region of Peel was identify grocery store locations. So as you can see here, the large G circle is a grocery store location. And next, we would go through using the ground truthing and orthophoto street view is to identify access points to that property where pedestrians could actually access the service, represented here by the green stars. So the next thing we would want to do is, an example here, is if there's any potential for an unauthorized access or an undocumented access to the property through an impromptu pedestrian path, potentially that locals would use to access the property. So an example here, you can see in the red triangle or rectangle that says AOI, or area of interest. We want to know if there's any place along that fence line that had a break that could potentially allow pedestrians to access the site without actually modeling their movement along the network. Again, using Google Street View, we can see that this was not the case, and so no additional access points would be added to the analysis. Next, using the appropriate catchment area, which all was derived from literature, we would determine along the pedestrian access and single line street network how far 800 meters from one of the access points would go into the parcels. So here you can see the green lines represent 800 meters along the street network, and the red is where the breaks would occur, so anything beyond 800 meters, which would represent roughly a 10-minute walk time. The next thing we would do is we would buffer these lines approximately 30 meters to intersect with the parcels, so we can then determine which parcels are actually within those service catchment areas. Next, we would isolate for anything at a residential or population level, just residential properties. So again, going back to our parcel-based land use, we would just, again, put a quick query on the data and only look for residential properties. Residential properties was very important in allowing us to estimate roughly where the population actually lives within a dissemination area. So for this example specifically, if we're using a centroid weighted, the centroid of this population would probably fall, or sorry, the centroid of the dissemination area would actually fall within probably the ravine system and be completely out of the service area. So all the population would actually probably be discounted as belonging to the service area. But by using our methodology and only looking at parcels marked as residentials within the service area, we're able to look at the total residential area within the service area with access to the service versus total residential area. We would divide those numbers and then take that result and times it by the population of the dissemination area to approximate the total number of people or percentage of people with access to the service within a dissemination area. And we did this for every dissemination area within the Region of Peel, so 1,650 in total. And then that allowed us to roll up the number to a census tract or census subdivision on demand as needed for reporting purposes. So here you can see why the value of using a service-aligned or delineated catchment area is far more accurate in producing a estimation of population with access to a service than Euclidean distance. So here, for comparative purposes, we've created the two service catchments, one using the service network and the other one just using Euclidean. And the difference between the population is 24% greater for Euclidean distance. So in the region of Peel, that accounts for almost 200,000 people. So to be off by a factor of like 200,000 would have been pretty significant for this exercise, and probably would greatly overestimated the number of people with actual access to the service, because it wouldn't account for physical or natural barriers in pedestrian mobility, including 400 series or freeway systems, as well as large river systems that cannot be traversed. So the next thing I want to talk about in terms of kind of a different approach to methodology is the Land Use Diversity Index. So this is something that we went back and forth with our academic advisor for a while to kind of determine what is an appropriate way to model land use diversity when we're looking at dissemination areas. If you know, because you've worked with dissemination areas in the past, dissemination areas tend to only account for residential property and not a neighborhood as a whole. So multiple times what we would end up with is if we ran our diversity index without using any kind of modeling for pedestrian movement between the boundaries of adjacent dissemination areas, is we'd have a very low diversity index because it's only modeling a residential area. So after going back and forth on this, it was decided that we should probably apply a 400-meter boundary buffer to the boundary of the dissemination area to represent the different types of land use that people could walk to within 5 minutes. So when doing this, again, using an example from the data, if we look at this dissemination area here on the left is just the dissemination area with no buffer applied. It represents a single land use type, which would be a multi-unit residential, and would have like a Simpson diversity land use index of 0. So basically there's no diversity in the type of land available. But once we apply that 400-meter buffer, which you see on the right hand, there's a plethora of land use that the residents of that dissemination area would actually have access to within 400 meters, thus drastically increasing the score from 0 to 7.9, which is one of the highest we'd actually have within the region. A next one, as Maria mentioned, kind of a novel approach that broke from literature was how we were able to monitor for street tree canopy. So what we were able to do here is we were able to take existing data that we had from a previous exercise, our urban forestry update, and actually look at the amount of forest and canopy cover that was adjacent to our sidewalk network that we received from our municipal partners. The municipalities would update this data on an annual basis and provide it to us at the region. And then we were able to kind of determine what is an appropriate buffering distance from a sidewalk center line that would represent, pedestrian canopy cover. So what we decided was appropriate for this is to use roughly a 2.5 meter buffer on either side of the sidewalk center line. And then we're able to intersect this with our high vegetation cover to act as a surrogate for canopy coverage. So using this, we're able to see the total area or the total sidewalk area that actually has canopy cover within it. So simply then what we would do is we divide the total canopy cover area by the total sidewalk area to get a rough approximation of the total area sidewalk that would have a canopy cover. To take it one step further, as a type of ground truthing to validate, is this canopy cover actually this good along a sidewalk, is we use LiDAR data to create cross sections through different types of sidewalk to actually model what it would look like. So in this case, what we're actually looking at is someone's backyard, because there wasn't a great location to look at. But as you can see in the image below the map, that's a LiDAR cross section shown. So we can actually see what the canopy cover would look like through that A to B cross section. So to take it one step further, after we had mapped this at the DA level, we started picking off some DAs that had very high returns, and then again using LiDAR data as well as Street View data, we were able to go in along the streets within those DAs to see did our representation at the DA level is it actually modeled in the real world using street tree canopy cover. And finally, I'm not sure if this is going to work. I'll click on to see if it runs. Is that we took, oh, sorry, it's not going to work, but we were able to create a video again using LiDAR return data for one of the high return dissemination areas and model that as a street tree canopy cover. And just to see what it would actually look like then, like what are the actual heights of the trees, what's the total canopy cover, and so forth. So it was kind of a neat exercise in cross-validating that hadn't really been done before in similar types of work. Unfortunately, the video is not working. So the next thing we moved on to after we had created our indicators is that as Maria said, we wanted to kind of go through an exercise to make sure that the work we had created could be reproduced in the future. So after each indicator was created, documented, and reproduced, our team focused on producing the next core deliverable, which was a composite index or component indicator that measures walkability within the region. During this phase, each indicator was evaluated against 6 criteria and assigned a score between 1 and 5 that measured our confidence in the data, methodology, and resulting indicator. So relevance tells us if an indicator is associated with literature that is supportive of improving health outcomes in the built environment and can it be used to support and inform future planning decisions. Simplicity tells us if the information presented in the indicator is easily understood and can it be communicated in an appealing way to our target audience. Validity tells us to what degree is the indicator a true reflection of what it was designed to measure, and did the data used to create the indicator have any known limitations that influence the result. Reliability tells us how confident we are in the methodology and data used to create the indicator, and did we use methodology derived from peer-reviewed academic literature, and if literature didn't exist, how confident we were that other researchers would arrive at a similar decision given the same objective. Data vintage tells us the currency of the data used to create the indicators as of 2016 and how confident we are that these data sets will be updated prior to or during our second iteration of the project in 2021. Data accessibility tells us how readily accessible the data sets used to create the indicators are and lets us know if the data sets had any access restrictions, including time or cost. So next, as we said, we scored each of our indicators across these 6 categories to kind of get an estimation of are any of these indicators probably not suitable to move on to a principal component analysis. So during kind of our initial iteration, we decided that there was, I think 7 total that we just weren't confident in the data sets to move on with. And for the remaining 14, they were moved into a PCA. So the remaining 14 indicators were standardized, converted disease scores, and included in the initial principal component analysis. However, due to multicollinearity, inadequate measures of sample inadequacy, and cross-factor loading in the initial and subsequent iterations of the PCA, an additional 6 indicators, those marked with the orange X's, were dropped. Population density, population plus employment density, intersection density, street tree planting, proximity of residence, bicycle network, and traffic calming. So the final ones marked by the green checks were included into our PCA. So once the appropriate variables were selected, we proceeded creating the composite indicator using a principal component analysis and standardized indicator values. The principal component analysis is a dimension reduction that transforms several correlated variables into a smaller number of variables called principal components. The PCA produced 3 components that explain 62.4% of the variance between the 8 indicators. The components that help predict walkability can be categorized as proximity to services, proximity to parks and open space, and density and housing mix. So once we had worked with our PCA, we moved on to creating our walkability composite index. So the composite indicator or walkability index was created using normalized scores and equal weighting assigned to each of the 8 indicators. The results produced a maximum walk score of 96.1 and a minimum walk score of 0.01 across the 1,650 dissemination areas within the region. The walk scores were then divided into 5 classes based on equal intervals and inside a qualitative descriptor of walkability. The qualitative descriptor would include very high, high, moderate, low, and very low. So the map here on the left-hand side shows the walkability score for the 1,615 dissemination areas within the region of Peel. So once this was completed, we actually started to look at the underlying population numbers associated with each of these. So what we can see is, concentrated in the downtown corner of Peel's municipalities, which have benefited from planning policies that allow for greater density and zoning bylaws that encourage the required mixed-use developments to support larger populations. More than 2 out of 5 residents live in areas classified as either high or very high. Just under a quarter of residents live in areas with low and very low walkability. These areas are typically concentrated on the outer suburban edges and in areas dominated by agricultural lands or natural features. The impact of natural and human environment on walkability can be observed in the southwest portion of the map, where major highway and river act as pedestrian barriers, significantly lowering the walk score compared to the surrounding areas. And additionally, existing planning policies related to these features allow for very low density development, which reduces a walkable destination to these areas. And in the name of time, I'm just going to kind of breeze through what we have remaining for NAPs. So once we had created our walkability, we kind of interpolated it so to see how walkability would move across the dissemination areas. That can be observed on the left, with the right representing the discrete values with the same color. And this I'm not really going to explain, but ultimately what it's saying is that walkability tends to be clustered or co-located within the region of Peel. And finally, what we're going to do is quickly kind of just show a quick example of our web application, which will hopefully go live starting in the new year. But the web application is hosted on ArcGIS Online. It is a story map that goes through the entire process that led up to the creation of the Healthy Development Monitoring map, including a breakdown of the issues facing the region of Peel. Again, land use planning currently associated with the automobile dependence, and then a breakdown of each of the 6 core elements, as well as the individual, let me just see if it loads here, the individual indicators within each of these themed dashboards. So once this goes live, you can actually go to the element of interest to you, and then explore within the map to see what each of these individual indicators look like within the region of Peel. And that concludes the presentation for us from Speaking Notes, and we can move on to the next steps with Maria.
Hey, thanks so much, David, for that. I'm just going to go quickly over this because I realize we're a bit over time. So just for our next steps, we're anticipating really creating our user testing process for the online web application. And so we're doing this in October, and we're testing it with the people who are most likely to use this tool. So that would be our internal and external planning departments. And then we'll be bringing this forward for approvals to our regional council and our executive team prior to the live launch of that actual application. And then lastly, we're also working on a technical report that documents the decisions we made in producing these indicators, as well as our Peel Walkability Composite Index. So this would be the GIS aspects of the decisions that we made, as well as kind of the public health expertise in the decisions that we made for the indicators. So that's currently where we are in the project right now. So David and I would be happy to field questions if there are any about this. And I apologize, Tina, for going over time a little bit, but we hope that you enjoyed the presentation.
Thank you so much, Maria and David, for the wonderful presentation. Do we have any questions from the room first? And for those of you on the phone, feel free to add your questions to the chat box, and we'll get to them accordingly. Questions from the room?
Yeah. Hi there, I'm Sharito. I'm here with BC Center of Control. Thanks so much for your presentation. I thought it was very interesting. It's full of information, and I'm wondering if there was ever, is there a plan, or was it part of the process to engage communities in this information, just because there's such opportunity there to showcase to residents of Peel the connections to health and what their community, what facets of their community contribute to active living.
Hi, sorry, can you hear me?
Yes.
Okay, sorry.
Cynthia?
Just making sure that this is still working. Yeah, so that's a great question. Thank you for asking that. So because this project is really like monitoring Europa 27 policies, we had an extensive community collaboration to actually introduce those policies and get those policies passed in place. So for this project itself, the actual goal and focus of it was our community, which actually resides in our planning departments, in both our internal regional planning departments as well as our external municipal planning departments. So we had extensive consultations with them. But I do hear you in terms of the actual indicators themselves. And when this is live, like anybody is actually able to go and see this story map.
Thank you.
Hi, this is Tom. I'm a contractor at BC CDC. I was just wondering, just out of curiosity, who the contact at McMaster was?
Hi, Tom. So we partnered with Professor Darren Scott in the yeah. And so, and
okay,
also,
yeah,
I should note that Professor Jim Dunn was the one who helped write the evidence base for this. So that would be the Healthy Development Index.
Okay, cool. Yeah, I'm a graduate from McMaster, so I've worked with Darren. Actually, and David, what's your background? Because that's some intense GIS work.
I'm so sorry. Could you just repeat that?
Oh, I was just wondering what David's background is, like his training, because that was some great GIS work.
So I did my diploma from Sault College, just a one-year dedicated program in GIS application specialist, as well as a few undergrad courses during my university degree.
Okay, what was the college again?
Sault College in Sault Ste. Marie, Ontario.
Oh, okay, cool. Thanks.
Thank you. Anyone
Sharito,
hog?
Go ahead.
Sorry, I should introduce myself. I'm Sharito, and I'm with the population health team at BC CDC, and my focus area is built environment. So I have a ton of questions for you, but I don't want to hog. I just want, the one question I wondered is if you have any sort of thoughts on the transferability of this to other regions that may or may not be similar in size, have different cultural backgrounds. Do you have any advice on if other communities wanted to take up this process, things that you would recommend?
I think we definitely do, and we're definitely in the process of reflecting on our lessons learned right now. One of the things that we really want to document in our technical report that's coming out is exactly the processes that we took, so that for anybody else that wants to recreate this using similar types of data sets, they'd be able to do it right away. And that's sort of something that we've always been really passionate about in this project, is to really disseminate that level of knowledge, both from the GIS side and from the public health side. And then, sorry, I don't know if I answered your entire question, but in terms of other municipalities actually doing something like this, it would be great for us to see that if they have that level of data available to them through their planning departments, to create that partnership as either public health or planning to actually recreate these indicators.
So a two-part question. Thank you so much for the amazing presentation. It's chock full of data. Just building upon what Sharito was laying, is the applicability of this model for reservation and or rural communities, whether or not it is applicable or relevant. And the other is whether or not that there is, I know that you're on a municipal level, and I was trying to look real quickly on the map of whether or not that there was any traditional and or reservations within your current catchment. And if there was or is, what was that engagement like?
Hi there. Thank you so much. So in terms of the applicability to rural communities, what we've actually come across is that there are different sort of built environment indicators that would be more applicable to rural residences. So that really is something that we struggled with, but through our consultation with our town of Caledon TAC members, we were able to kind of come to an agreement that if there is actually any development in Caledon, it's mostly in the what we call the white fields, and that would be development that's similar to other regions in the region of Peel. So that's sort of something that we've always put as a caveat. It's not as applicable to rural walkability. And then, I'm sorry, I think the other part of your question was on traditional reservations. So right now, we didn't have that actually mapped or documented in this, but for our ROPA 27 policies, there was extensive consultation with our Indigenous community members here. And that's actually, you can find that online through the consultation process in our ROPA 27. So that would be the Regional Official Plan Amendment 27 policy review.
Thank you.
Maria, I have a question for you too. So this is Tina. Just wondering about the uptake and feedback from the municipality and local government side. Are they interested in taking this data and incorporating into policies to create healthier communities or more health promoting indicators in the communities?
That's a great question, Tina. Yeah, there is lots of interest from our local municipalities, especially because they can use this data in their everyday sort of work. And then, so we've been engaging with them throughout the process as either as technical advisory committee members or just doing presentations to them to keep them in the loop of what we're actually up to. And then I think the other part of the question, sorry, could you repeat the other part of your question?
Oh, no, just whether they're incorporating into their policies to create more health promoting environments.
Right. Yeah. So we have had some, like we've been able to actually give this data to some community groups who have been actually trying to plan for healthier built environments, and so we've actually had them reach out to us through other means of communication. I guess after we've presented to somebody just that they're interested in this data, but we hope for a lot more of that once this actually goes live and is presented to our regional council.
Okay. Thank you. Do we have any other questions? I don't think I saw any online. Yeah, no questions online. So if there are no more questions in the room, I guess that's the end of the seminar. And thanks again so much for your presentation, Maria and David.
Thank you so much, Tina, for hosting us here. And thank you, everybody who attended.
Thank you.
Thank you.